Hello everybody, I'm Dr. Tony Carrion. I posted a video on Facebook and the Zero Dentistry group, and I received many messages about the laser surgery that I did, and I'm using this video to explain a little bit about the concepts and to solve many doubts that I receive in private messages, okay? So I'm expert in laser, and I'm using the laser many years to do everything about the aesthetics approach. And with this kind of laser, we can do an amazing approach on the tooth, the gum, the bone, the restorations for our ceramics or composites, and of course to finish a beautiful smile. With the frame of a smile, this is the lips, okay? So many doctors are using the laser for eye surgery since 30 years ago because of the accuracy. The laser that we are using is the same type of laser that the surgeons are using for the eye surgery, okay? So to do this kind of eye surgery, you don't need to numb the patient. Just a few of topical drops. It's totally possible to numb the patient. And of course, after the surgery, you don't need to use sutures because the laser will improve the healing process. So every benefit that this kind of laser is offering for the surgeons to do the eye surgeries, we are achieving in our dental daily practice because it's the same type of laser. A few things it's very good to us to understand. Many of it's because we can work based on 4 pillars. No matter what are you doing, the laser is biostimulating the tissue, is disinfecting the tissue, it's more minimally invasive than any other tool in dentistry, and of course is offering a very good comfort for the patient, for the doctor, and also for the assistant. And if you want to be very well succeed with this kind of laser, you need to combine the light of the equipment, the water of the tissue, and the movement that you're doing during your procedure, okay? And it's not philosophical sentences when I say, and I always say, the laser is life, because laser is always improving our daily practice and offering a very beautiful post-op, okay? So the equipment is just a way to us to achieve the benefits. So when we are working more than buy a laser, we need to implement the laser, and this is what we are doing many years, implementing the laser for our colleagues, okay? Because side by side, mano a mano, we can work together to improve the practice when you are buying a laser, okay? But remember, the machine is just a way to achieve the benefits. Many doubts is concerned about the way that the lasers are working. So lasers are not the same. Lasers are 2 different behavior when are you working, depends of the type of the laser that are you using, okay? So if the lasers are not the same, what is the main difference? The main difference of the laser is based on this. What is the name of the laser? The laser that we are using is an erbium, but erbium has some types of erbium. So our laser has a name and also a surname. It's an erbium YAG. It means that inside of the handpiece, this laser is fiberless. We has one crystal. This crystal is made by garnet and doped with ions, erbium, yttrium, and aluminum. When this crystal receives the electric energy, those ions change their own polarity and of course make the light goes out. Okay, so it's fiberless, so we have 360 degrees to turn and also an angle of 120 to angle the laser. So we have a free movement with the handpiece. This is very, very ergonomic. But mainly the laser difference is based on this chart. Okay, so first of all, as poor human beings, we can see a few colors, from the yellows to the violets, from the yellows to the reds. Before the violets we have the ultraviolets we cannot see, and also after the reds we have the infrared, and also we cannot see. So we have this chart. This chart is the interaction, the laser interaction chart. The most known type of lasers is the diodes. Diodes we have two mainly different types of diodes. We have the low level therapy. This is low level power of diodes. We can do only two things. It's based on biostimulation and decontamination, and the high power diode laser you can cut. Okay, but you can cut only tissues with hemoglobin and melanin. So it's based on to work with soft tissue. And low level you can decontaminate and biostimulate in soft tissue, and high power you can cut soft tissue, but you can decontaminate a root canal, for example, using the diode, but you have to paint the bacteria using a dark pigment like blue of methylene. Okay, so but the laser that we are using is in a different position. It's with a wavelength of 2940 nanometers. This kind of laser will interact with two different things, with hydroxyapatite and also water, but it's preferred water. This kind of laser loves water. Has another erbium laser. It's not like erbium chromium, but is in a different wavelength. So this difference mainly will offer 200% of efficiency for our type of laser, because the erbium YAG is like light touch and photona, and here you have the erbium chromium. This is called water laser. The ideal coefficient of water absorption is near than 3000 nanometers of the wavelength. So this laser we has a difference of 160 nanometers. It's a small difference in nanometers, but about the coefficient is too far. So this is the reason then many people said, oh, I tried to use a different way laser and it has a very different results. It's because it's another type of laser. It's not the same. It's an erbium, but erbium has mainly big differences. Okay, so one thing it's very important to us when we are working with erbium YAG. So we have a very similar results when you are using the cold scalpel and erbium YAG. So it's almost nothing of difference. When you have a connective extension of damage, depends of the type of the instrument surgical. This is a comparison between the cold scalpel, erbium YAG, CO2 laser, diode laser, and the YAG laser, and electrosurgery. Okay, this is the main difference. The cold scalpel the Erbium YAG laser is very, very friendly of it. The same is with the epithelium. The epithelium, when we have using the cold scalpel and also the Erbium YAG, the results are the same. So you have nothing of difference. That's the good friendly is very friendly with the tissue. Okay. And it's a very possible instrument of choice for the surgical removal of this kind of lesions. So let's check about the tissue. So checking the histological images, we can see all these types of tool, like CO2, Erbium YAG, diodes, ND-YAG laser, electroscalpel, okay, and cold scalpel. Let's see the four most known instruments, okay? Erbium YAG is the laser that we are using, and the cold scalpel. Check the integrity of the tissue. The integrity of the tissue. When are you using diodes or electrical surgical, are you losing parts of the tissue? This is the way that I'm always choose this kind of tool. And why is that? Because I can do this without anesthesia, and I'm also decontaminating the tissue, and I'm also achieving a very good post-op. This is the way that I prefer to use this in comparison of it, okay, with the scalpel. So if this kind of laser works with water and hydroxyapatite, we can call this like an all tissue laser, okay? So the reason then we can cut the gum, we can cut the tooth, we can cut the bone, and also we can do therapy. And we can do therapy because we are biostimulating the tissue, the odontoblastos, the osteoblastos, and also we are decontaminating because the bacteria body is made by water. So we don't need to use any other product associated to do decontamination. If I wanted to decontaminate an implant surface, I just aim the laser and I'm killing the bacteria. Okay, this is the main picture about this laser, because I can cut a graft of bone or a graft of the tissue, soft tissue. Let's check the behavior of the laser when we are cutting. So depends of the movement that I'm doing, the angle that I'm using, and just touching the tissue. I don't need to pressure because the light is cutting. We are not doing pressure over the tissue. It's just the light. Okay. Now we are simulating an incision, and now I'm releasing the flap. Okay. So are you seeing why we can have a very good post-op? Because we are not using tool to scratch the tissue. We are just using the light to release the fibers of the tissue, and with doing this we are showing to you a very clean surgical site, less bleeding, and also biostimulating this tissue to achieve a very good post-operative. Okay, so other thing that we are doing is just showing to the laser what we can do. Depends of the angle of the tip that we are using, the laser will cut or will not cut. Okay, this is very, very important because the laser is always protecting you. So when I'm finishing now, I'm simulating and I'm taking gingival graft. Okay, so as I'm taking a gingival graft, now I change the angle and the light is cutting. Now I'm just releasing the flap. It's very easy. Now I'm changing the tip. I will I'm taking round the tip just because I want to do a graft pinning, because I need to improve the vascularization of this graft. The reason then I will go over the table and I'm doing removing the epithelium of this tissue to work with a better vascularization. Now I'm vaporizing the bone. I'm not cutting the bone. Now I'm vaporizing like a crown lengthening procedure. Okay? Check what I'm doing. Just the angle. Now I'm cutting because I changed the angle. So when you change the angle of the tip, you have a different behavior of the equipment. And of course, I changed the parameter for soft tissue, that I was doing the incision and releasing the flap and also the peeling. Now I'm working in a hard tissue. It's just taking the osteotomy parameter. But when we are cutting hard tissue, we can go over the soft tissue, and the laser cannot cut the soft tissue when we are using a hard tissue mode, because the laser, it's very, very selective when we are doing when we are working with the laser. Now I change it again the angle in hard tissue mode, and I'm doing the tooth sectioning. So you can see that I'm taking out this root. It's just very, very precise, very quickly, just cutting. Okay, this is the procedure then we are doing in a few seconds only. So to do everything then I show it is just using one tool. I don't need to change the scalpel, the mold, and go back with the scalpel, so and go back with burr, change the burr. No, it's just the laser and it's enough. The laser airborne YAG is very safe because it's superficial action. It's very different than the ND YAG and diode, because those lasers is working very, very deeply, and those kind of lasers trying to find hemoglobin and melanin. The reason then they will find hemoglobin in the pulp and can hit the tooth. The laser is always working with water, and also in a superficial way. It's never will doing an inflammatory process. Okay. To do the case that I show it in the post-it, I wanted to clarify a few things, that I'm always using the floss, because the floss is doing an orientation about the angle of the smile. If the smile will go sad or happy. Okay. And now I'm not cutting, I'm just erasing. When I erase the mark, it's because I achieved the high level that I wanted to. Okay, and I can go to do another central, and I can come back for this one. Okay, so you can check the level, check the difference. And I'm going up. So check. This is very down, this is upper, and now I'm starting. So it's a 2 millimeters surgery. It's not too much that I'm cutting, but it's totally okay. Check. Very small bleeding. Now I'm seeing I'm achieving the same level. I'm just doing other thing. In the middle of the surgery, I can release the lip because I'm not numbing the patient. I'm using without anesthesia. Okay, I can release this and check the lips line because it's our reference. Now I'm doing the canine. Okay, this is the movie that I showed. The most important thing is the post-op, because the post-op it's amazing. This patient is assistant of the clinic that I'm doing the surgery. This is the immediate result. So we just opened a little bit more the zeniths. We designed better the lateral and the canine, but her lips, it's very, very low. We don't need to go too much upper, okay? So this is a zooming video. Just we are not cutting. It's like we are brushing, erasing the gingiva, okay? But it's not anesthesia. We are not numbing the patient, okay? The patient is not numbed. And the next one, I'm showing to you the osteotomy, the flapless osteotomy, okay? I'm speaking in the movie. So here you can see I'm marking 3 millimeters because I wanted to give back and respect the biological space. So when I cut in the hard tissue, we cannot cut in the soft tissue. The reason then I'm just going over the bone inside of the soft tissue. Are seeing a little bit more of bleeding, but it's just enough of to good and to achieve a very good post-op. Okay, it's just to you to check. So this is a real case because here we have the first picture before the procedure, and you see the very amount of gingiva here that we have to bring back in the good level. And here we have to do like a copying this central to this one, and using the same size of this lateral for this one, and bringing up the canines and also the premolars. Okay, so this patient, this is good to explain. She's a student of dentistry, and during the training I did this case in Venezuela. She mentioned during the explanation, so why we need to respect the biological spaces. She's very new in the dental school, don't understand a little bit about the biological spaces. So okay, I'm always expending 15 minutes to do gingivectomy and also osteotomy, flapless osteotomy without anesthesia. I'm showing in your case 15 minutes today and 1 minute tomorrow, because I want you to see what happened when you are not doing the biological space. Okay, so, and I did the surgery. This is the planning. Okay, we have to bring this gingiva to this level and to do the centrals and the canines more upper, and of course the laterals and the premolars 1 millimeter above. So check. Now I'm doing the surgery, we are doing lives. So here I already cut the lateral when they start to do this movie. So in the same way, it's another patient, but I'm doing the surgery in the same technique, just erasing the gingiva. Okay, erasing the gingiva. I did the plan in the same way, so it's everything in the same way. But most important, I did this surgery April 23rd. In the next, after this is immediate after the surgery, just gingivectomy. I didn't the osteotomy because the osteotomy I'm doing the next day. Okay, so, and in April 24th, the next day, she came back to the clinic, but the gingiva did this kind of migration because we didn't respect the hard tissue, the biological space. So I did the osteotomy. I also do flapless osteotomy without anesthesia, okay, with this kind of laser. And she sent me, I flew from Venezuela to New York for a course there, and she sent me in April, 4 days after, she sent me this picture. This is a cell phone picture. It's not a professional picture. I said sorry, but I just asked it to her. So please send me a post-op, just because I wanted to check what is happening with your healing process. So this is 4 days after. So if one patient goes to your clinic with this kind of gingiva, you can prep, you can take impressions and everything. This is the marvelous side of the laser, because only laser can offer to you this is amazing post-op. Okay, so if you were heating the tissue, or if you are burning the tissue, we never will have this kind though. So the laser works totally different. Laser is healing, it's improving the healing process, it's accelerating the healing process, it's biostimulating, and also the surgical site is decontaminated. So this is immediate, 1 day after and 1 week after, okay, from 24th to May 2nd, okay, this is 1 week after. So this is very, very stable. And now how she is. Check, very stable, okay, very stable. The stability of this level of a gingiva, it's because we are respecting the biological space. So this is our little class that we did. So you can follow me on my Instagram, Tony Carrion 10. So thank you to the members of the group. So I'm Tony Carrion, and I'm waiting for you on our Instagram or Facebook profile. Okay, thank you, bye bye, let's go laser.